Thank you very much. So, Kintampo Health Research Centre. I think the purpose of this presentation is to network and let you know what is happening in the sub-region and possibly your next facility for your research activity. So, we are one of the health research centers for the Ghana Health Service and based in the middle belt of Ghana, established in 1994. And of course, as I said, part of the Ministry of Health. And there are 3 research centers in Ghana. In the northern belt, we are in the middle, the red colored, and the other one is in the southern part of Ghana. So our research had started by this vitamin A project, which was in 1996. And that was in collaboration with the London School of Hygiene and Tropical Medicine. And this actually built levels of capacity in the area of what we needed for field work and the data capacity build-up. At least you can see some of the pieces, but that's not how it is now. So now you come in, we are using tablets and other things, but the first project has set up this capacity that we built on and move forward to do clinical trials. And that actually will let you know the first team under the leadership of Professor Seth Owusu-Adjei, that is the one in spectacles at the far right. And he had led several clinical trials from the malaria vaccine RTSS, which currently the WHO has recommended for use on large scale, and Ghana as part of 3 other African countries, Malawi, Kenya, are on the pilot evaluation of the malaria vaccine in Ghana. So we had used that capacity and we thought that what have we achieved? It's good to assess the collaborations that we have built and what we can move forward to do. And having our vision and our mission, we set up these goals that we thought if we are able to achieve, we can move forward in terms of research and capacity building, technical capacity, financial sustainability, and looking at the people and the culture and how we can build strategic partnership. So all these things were put into a strategic plan that helped us to move as an institution. I think we build it every 5 years. And 2022 was the time we had built one up to 2026. So that is going to be used to always evaluate the collaborations we have had and the resources we have had from our partners and all across the globe and what we have been able to achieve. So the mission is clear, and as I said, as part of the Ghana Health Service, we are with these core values: excellence, innovation, inclusiveness, and accountability. And these are the things that we use to move across the research goals that we have set. And we saw that it's good we put our research activities into thematic areas, and that we run across the health policy and program evaluation, clinical trials and intervention research, family health research, non-communicable diseases, and environmental health research. So these are the thematic areas that we mostly run our activities, and time will not allow for me to go into each and every one of them and what we have done over the last 25 years. And in our count, we have had over 40 international collaborations across the globe. And we always want to be sure that we are all having mutual support and benefit. And of course, you look at it in the research and capacity building areas. So that is how you look at the strategic collaborations that we build with partners. And maybe you could be the next one that we'll be having and coming to the middle belt of Ghana for us to continue with our respective research agenda. So in our review, we are having a research lab, that is where I work, the Seth Owusu-Adjei Research Lab, and that's how the facility looks like from the aerial view. That is with the help of the drone, we have been able to set that up. But at least we have done all these things with leadership support. The Ministry of Health actually has been very helpful. The Ghana Health Service has been very helpful. So it makes your research moving into policy become easier. And if you look at some of the pictures that are going to follow up, you realize that we had a visit by the Minister of Health. The Ghana Health Service Council had also visited the facility, and we have had a dedicated team that helped us to do all these things, cutting across research officers, research fellows, our drivers, our security, our national service personnel, and all across the various spaces of professional requirement that we need to do the necessary research that we've been doing. And as I mentioned, our stakeholders, the Minister of Health, the Ghana Health Service, our traditional people have been very useful in helping us reaching the community and making sure that the research that we do, because you can't do research just by yourself, but you use the people around you, the community that you have. And it's been very helpful once you have this leadership support. And that over the past 25 years has been very helpful in making us impactful in the community. So once in a while we have stakeholder engagement, the community support, our traditional people come around, get to know about the work we are doing, and have the opportunity to ask questions and see the facilities. But one of the things is that when you start taking blood samples from people, they worry as to why you are taking them, what you do with the blood samples. And coming around in such issues help them to understand what we do with the samples we collect. So this is a clinical trial facility that we have, and we've been able to carry out some phase 1 trials. The recent one we just wrapped up was on the Lassa fever phase 1 trial. We have been part of the COVID vaccine trial, some malaria drug trials, and all have been leveraged on the capacity that we have from the 25-year collaboration we started with the lab and with some biochemical hematological platforms and malaria microscopy center of excellence, as we have trained over 1,200 medical laboratory scientists in Ghana and across Burkina and some eastern part of Africa. So if you look at what we have built, what we have, and what we have used over the period, it's very useful for us to know that just zeroing in on malaria alone, we have had some drug trials with the ACTs. Before the ACTs came into play, we had to look at whether the chloroquines were working, and all these things moved into the policy for us to accept the ACT. Malaria vaccine, I've already mentioned it, and we are currently evaluating the post-licensure. And as we speak, we are going to take the next step in the next coming month for us to evaluate the malaria vaccine and its impact with the PMC, the perennial malaria chemotherapy. And that is something we are currently also going to undertake with the London School of Hygiene and Tropical Medicine. So from these works, the WHO was good in recommending for the use of this malaria vaccine in children less than 5 years. And Ghana is one of the countries that has deployed the RTSS malaria vaccine. And the hope in the last celebration by the World Health Organization is that in 2024, it's going to be rolled out to a lot more of African countries to be able to save the children at risk of malaria. So when you look at all these things and you talk about the impact that our research has had over the years, I would say that Kintampo Health Research Centre is one of the centers that if you are targeting anywhere within the western part of Africa, in Ghana, you move nowhere than come to the middle belt and make sure that we have a good research that we can use to facilitate the agenda that we all have and what we are talking about on this particular platform. I want to say that we have had all these people supporting the work we have done, cutting across from the government of Ghana, the Ghana Health Service, the EDCTP, Bill and Melinda Gates Foundation, and some pharmaceutical companies, the GSK, Sanofi, the Novartis, have all been very impactful in helping us in the diversified resources that we have had over the period. You put in your own proposals, bring up the ideas, and go to discuss with them and see whether some of these things could be funded for us to affect life and move research into policy. So it's been great, and I must say that if you are having any other avenue that you want to come and have research, don't look any further than Kintampo Health Research Centre, because when the resource is built, capacity is imparted. And you can see the malaria microscopy training that we have done, and I mentioned the numbers that we have done over the period. And we have students coming from outside to come and have their internships, and also the public health training institutions in Ghana equally bring patients, their students to also come and be served. Georgetown University, Columbia, and the PATH. And we have not kept everything to ourselves, but we try to communicate it. And we have our various handles, the social media handles, the website is active, and the respective publications that once in a while we put out there to let people know the work we are doing, the scientific publications, and how it impacts society. So anytime you are looking up Kintampo Health Research Centre, our social media handles, as have been outlined over there, just get in touch, and definitely somebody will respond to you, and you will get to know that there are institutions that exist. We don't do these things without challenges, but we don't look at them. We try to overlook it and see how best we can build up, and look at the collaborations we have built, and the opportunities that have come out of them, and how best we can overcome the challenges that are within it. But in all, it's important to know that after the collaboration, what exists, something must be sustained. It's not just bring money, we finish, and we are done. So I want to end here and say that Kintampo Health Research Centre should be your next station if you are coming to Ghana. That is the center of Ghana. Thank you very much.
Thank you, Dr. Dennis